Dr. Henry, yes, your time start, please. Dr. Henry, are you there? Am I audible? Doctor, am I audible?
Yes,
Yes,
we
you
can
are.
hear
Yeah,
you.
yeah, you're audible. Yes, I'm ready. Okay. Hello, I'm Dr. Henry, one of the doctors here today. May I please confirm you are Mrs. Sarah Williams, 29 years old?
Yes, doctor. Mrs. Sarah Williams speaking. I'm 29.
All right, I've come to discuss concerning your health condition with you. Mm, will you mind if your loved ones be in attendance in our discussion today, or can I proceed alone?
No problem. You can discuss with me. If really necessary, I will call my husband.
All right. Just to ensure we're on the same page, could you please tell me what you know concerning your condition, Sarah?
Yeah, yes, sure, doctor. It was, to be honest, completely horrible, okay? And what
Hmm.
actually happened, I developed, shakiness all of the four limbs, okay? And it happened not once, it happened twice in the last 2 months. In the first episode, I completely ignored that. And second episode was noticed by my husband, and he brought me to your clinic. And your doctor did some scan or few other tests. I don't know actually. So I just want to know, doctor, what is the test results and what's going on?
All right, I will tell you, Sarah. Actually, as like you said, you came in with complaint of loss of consciousness for a short duration of time. You
Yeah.
have so and then we did a test. We did a test that shows some that shows some tracing of your heart, which is called
Hmm.
ECG. And
Hmm.
the good thing is that it came out to be normal. We also did a test to look at your brain to see if there's any problem with the structure of your brain, which is called the MRI brain.
Okay.
And it also shows that there's no structural problem
So
with your
also
brain.
good, right?
Yes, but however, we also did another test that shows the nerve impulse, the how the nerves function in your brain in terms of the activity, nervous activities in your brain.
So,
However,
so,
the
so
pardon?
what you said, doctor? It seems to be very serious or something you said. I did not get you, doctor. Yeah.
I said we have the results shows something that is very concerning,
So what do you
Mrs.
mean by
Taylor.
concerning, doctor?
Actually, the EEG, which is the test that shows the way the nervous fires in your brain, is shows a kind of epileptiform activity, which is forget don't mind my language, is a shows what they call an epilepsy.
Oh my God. While you're saying something completely new for me. Epilepsy and EEG. What actually happened, doctor? Why I lost my consciousness and I was completely out of the one, and it happened twice, doctor. What is the wrong? Is it my brain
Um,
or something else?
yeah, your question is valid, Ms. Sarah. Actually, there is the way the nerves in your brain are kind of firing without control, and it
Mhm.
occurs they occurs uncontrollably, and
I
this
mean,
is what we
is it
pardon.
common for every patient or everyone, right? Brain always fire. and that's how we walk and talk, right? But what
Uh,
actually wrong in my case?
Actually, in a normal brain, or people that is not sick or not don't have this condition, their brain responds to certain signal from outside, either from lights, from noise, anything at all, from emotional. They respond and fire normally. But in
Mhm.
your own case, the way your brain respond to such stimuli, sometimes it's kind of misfire and fire in an uncontrollably way.
Oh my
That is
God. I
what
mean,
we
and
refer to as an epilepsy.
it sounds really, I mean, atypical. It's not usual things happen. And why this is firing, doctor? I mean, is there anything problem in my brain? Because it never happened in my last 29 years. It's
Yeah,
completely
yeah,
very
yeah.
first time for me.
I can imagine what is going through your mind. Actually, the likely cause we cannot say categorically now, but the what is caused is called epilepsy, and the good thing is that it's something that we can control with medication.
My God, I mean,
Yeah.
you're really giving me, making me scary, doctor. I mean, is there any treatment options that can solve the problem?
Like I said, the good thing is that there's a medication we can use to control it and to prevent you from having similar episode. And this is called the anti-seizure medication. Is a
Okay,
drug that
that's really good, doctor. I mean, good to hear. But is it possible to completely come out of this disease, doctor? I just want to
having
come out of this situation. It's really, I mean, horrible last time. It was so jerky and I was completely lost of control myself.
yeah, it is normal for you to think this way, Miss Sarah. Actually, if you want to commence the drug for you, I'm going to tell you more about the drugs. If you take the drugs regularly, there's a big possibility that you may now have a repeated episode of this shakiness of the body, which we call seizure.
So
And
you mean I have to stick to the medication? So how long I have to take this, doctor?
the question is valid. Actually, I must confess, you are going to take for a very long time. For a very long time. I cannot say probably it's going to be in maybe 10 years but what I can guarantee you is that if you take it consistently for a very long time, after certain
Two
maybe
two
about
minutes left. Okay.
yes, we'll
So
monitor you. I didn't
carry
get
on.
you said what?
Carry on. Continue, please.
Okay. You will take the medication for a very long time. We'll monitor you and then we see if you continue to take, if you don't have any symptoms after certain years, we need to taper you down and then give you
So, I mean,
some
you would
space.
like to bring me back into the clinic, and that's how you will follow me on the follow-up session, right?
Yes, doctor.
Yeah,
Yes,
but
so.
I'm planning to have a baby. I just recently got married, and me and my husband was planning to have our first kid in my family. And I'm very concerned about that with this situation, doctor. What would be your
First of
advice for that?
all, congratulations first of all on your marriage and congratulations for planning to have family.
Hmm.
Actually, some of the medication may not be friendly with pregnancy, but it's a good thing you bring it out now. What we'll do is that we'll link you up with the fertility doctor, and when it is time for you to, when as you are getting ready to get pregnant, we'll give you the medication that may not alter your pregnancy and follow
So
you
you,
through.
you you mean, I mean, the medication might not be safe for my baby as well, right? Oh
Yes,
my
yes, but
God.
actually we'll link you up with the fertility doctor. So we'll come into agreement with the kind of medication because there are some that is safe with pregnancy. Then when that time comes, we can switch you to that particular drug that is safe in pregnancy, and you can continue in that way. Is that okay with you?
Yeah, I mean, that sounds really good. That sounds good, but still there is chance of injury or have harmful baby. I don't want it, doctor. Okay, so yeah, to what you think appropriate, doctor. So what's my next step? I mean, you want to start the medications. Apart from the medication, what would be your advice for me, doctor?
Okay, once you start the medication, I'm going to give you a leaflet that contain the side effect of the medication. We advise you if you do you drive.
Yes, doctor, I have to drive every single
Okay,
day.
and
Time up.
okay, so
10
okay,
minutes,
all right.
completely 10 minutes. Actually, in the real exam, I'm pretty sure you will not get. 9 minutes 30 seconds because you have to change the room. Then an examiner will introduce to the surrogate. So hopefully 30 seconds will cut off from the 10 minutes part. Okay. So how does it go?
Yeah, it was fine. It went well.
Anything you could have done differently?
Just to advise about the driving, which I did.
Fine. I assume
Um,
that you does the driving part apart from this.
mm, mm. I think outside that, I think the patient was kind of was responsive. I addressed some of his concerns. I think basically the other thing I would have done is to the support to see if he has any support at home. The kind of since he's a
Yeah.
homemaker and support his occupation, support his social life. If he's smoking, if he's taking alcohol, I want to address that.
Fine. Okay.
And
So
also,
there are lots of things you want to touch if you are given the say, proper time. Fine.
yeah.
I would like to go to the feedback part, but I would like to interact with other candidates to know your opinion. What are the things Dr. Handy did well? What are the things you think we should cover in this type of scenario? Then I will go to the feedback part because although one candidate is practicing here, but I would like to know your perspective. What are the things you think it need to be addressed in this type of scenario in the non-visible task part? Anyone has any comment?
Hobby, about the hobby.
Hobby, right? Fine, thank you. Yes, must.
Okay,
It's a must.
and some advice for high altitudes. If you go to the toilet, don't go close the door.
I mean, some safety net, Dr. Hassan, you're trying to say yes.
Yes.
Yes. Apart from this,
About the job,
yes.
job.
In terms of the job, what you want to say?
If her job is a high risk job, so I will advise her to change.
I mean, there is no if. I mean, as it already given in the scenario, patient is a homebred decorator by profession. So what would be your take on?
Take on if she has like if there is ladders and doing something to avoid this. About the sleep also, and about television.
Yeah. Television, yes. I mean, you're trying to say safety net to avoid the stimuli, right? That can provoke the abnormal electrical signal in the brain. Yeah. Fine. Apart from this, any other important point need to address in this scenario? Okay. Fine. Well done, Dr. Henry. I would like to discuss one by one. So I always say in the pieces, there is no word or no sentence. They just add for the sake of scenario. No, every scenario and every word brings some value, add some, flavor. Probably there is some hidden concern is there. In this, before going to the deeper part, I would like to say why the home decoration is mentioned here. Definitely it's a big clue, right? Patient is planning to have a partner or just recently started a partner, right? These are the clues. Second episode is confirm epilepsy. These are the very big clue then. Okay, so starting from the very beginning, again, I would say, Dr. Henry, in the PCS exam, you don't know what type of examiner you are going to face. So it's very, very recommended and imperative from my side to play the safe game. Exactly mention your role, mention in the scenario. I'm one of the doctors in the nerve and brain clinic or department. I mean, you are saying just I'm a doctor, that's fine. It's not a mistake, but I would say play the safe game because you don't know. Your first impression could be the last impression and it can save 1 marks. Probably examiner is planning to give you 9 marks and your impression can bring up and convert it to 10. I mean, that's what I'm saying. Start from the very beginning, start exactly what is written in the scenario. I'm one of the doctors in the nerve and brain clinic. Then you introduce in a very good way how you want to be addressed. This is Sarah Williams, and I said from my side. And agenda was missing. Agenda means always after introductions, you always take the agenda. We have been gathered here to discuss about your health condition and what can we do so far. This is the default sentence we should mention in every communication scenario, right? Which was not missing. which was missing actually. You just directly ask me what you know or what you have been updated. You jump to that part. Okay. So first, set the agenda. We have been gathered here for what? We have been gathered here to discuss about your health condition and the test results we did so far. Is it fine? I'm going to make some note. It's optional. I'm going to make some notes and keep it hidden. Okay. And be confidential. Before going to the discussion part, I would like to invite someone of your family member, or do you have anyone to be present here? Okay, it's just formal invitation. They can say no, no needed. My husband is waiting outside. You can discuss with me. Then you can move forward. Then taking the knowledge, or taking the knowledge and perception. How far you know about your health condition? Can you tell me how far you know about your health condition? What have been updated to you so far, so that we can be in same place? You exactly said that. That's really good. Okay, and sometimes in typical scenario, this type of scenario or any other scenario, some mentors say, check the expectation. What's their expectation? Sometimes in not every scenario, you don't have to check the expectation. Or if you say, okay, what is your expectation? It's a very big clue in some way, because by checking the expectation, you know how they're emotionally strong. If they say, okay, doctor, I'm pretty fine feeling and expecting that test results would be normal, it means patient is very optimistic. In that case, you have to be very sensitive, gradually break down the news. If they assume something or just got some flavor, there is something wrong in their brain, you can be a little bit straightforward. Dr. Handy, are you getting me? What I mean by that? By checking the expectation, you can get some flavor. Okay, should I go straight forward or a little bit faster, or I should be a little bit more slow? To break it down, because patient is very optimistic and patient is not ready to hear the news. Okay, then you can actually bring to the clinic and how far you have been updated. So, but then patient will explain, doctor, I had jerky movements for the second episode and it was really horrible. I lost my consciousness and my husband brought me to the hospitals. Okay. Then your doctor did some scan. Then you have to say, yes, you are right. I appreciate your knowledge. Always echo with the patient. All the patient said up to this point, from the scenario, patient was bring to the hospital and your doctor did some scan. Still, I would say echo with the patient. Do you know why? To check the baseline, as if you are doing and completing the task from the very beginning. And how you can do that? I appreciate your knowledge. You are right. You had the second episode this time and you lost your consciousness, and luckily when noticed by your husband, brought to the hospital and we did some tests. Okay, do you want me to explain that? Yes, doctor. What's actually what about my test results? Then you can say, fine, we did several tests. We've did heart scan of the electrical activity of the heart, that's showing completely fine. Always use the good word first. What is good for them? Okay, because you have to climb up the ladder of the communication gradually. So give some flavor of goodness. Okay, we did some scan or electrical tracing activity of the heart that's come as normal. That's really good. Okay, we also did blood test, which is also normal. And MRI scan of your brain also showing nothing problem in your brain. Only one thing is showing something we're not hoping. In this part, a little bit slowness is very recommended, because you are going to say something, patient will be shocked. Okay, because you are going to mention the EEG part, right? The electrical tracing activity of the brain is showing something abnormal. So, doctor, what you mean by abnormal? Okay, fine. Our brain actually spark time to time to control our different parts of the body. This is how we talk, sense, smell, and move. In some case, due to unknown reason, there are some abnormal electrical signal, okay, generated from the different parts of the body and create the abnormal shakiness or excessive movement of the different parts of the body, and that exactly happened to your guest. And this is the explanation Dr. Henry probably miss. You just give me the abnormal spark, but how it is, converting into the reality of convulsions or just shaking of the hands, you have to make it very plain to the patient. Otherwise, patient probably would not get the, whole idea. What is the relations of the some spark and some abnormal movement? Because this is how our brain works. Our brain control everything, how we talk, how we walk, how we move our hands and smell everything. But due to some reasons or unknown reason, we sometimes don't know, okay, what is the underlying cause. We have to do a few other tests and have to monitor a few things. Only then we can say what's actually going on. But we are pretty sure the electrical tracing activity of the brain is showing there is abnormal spark and that causing the problem. Are you following me? Yes, doctor. Is it treatable? Yes, it's treatable. It's controllable, but it's not curable. It's not curable. In sometimes and many patients, after taking long-term medication, they can withdraw the medication. That's the good part. But in most of the cases, you have to give the answer. It's actually lifetime medication. Might be on lifetime medication. Okay. And time to time, would like to bring you back to the clinic, evaluate, and see the progression at the same time. See is there any side effect you are facing on, and we'll optimize the medication time to time. Are you following? Yes. And at once I say, doctor, how long I have to take the medication? Dr. Henry specifically say 10 years. I noticed it. So I always say in the basis it's that you have with the number. Although you were right at some point, but examiner, those are taking the exam, they are not completely out of the current guideline or probably 10 years time frame. Okay, in that case, they might be a little bit, sticky or vigorous in terms of marking. Better you can say, yes, after taking long-term medication, it can be 10, it can be, a decade, or just you can say after taking long-term medications, or yes, we might withdraw or minimize the dose of the medications. Okay, so this is the part you can address in that way. And lastly, when just time is running out and the last 2 minutes, okay, you does the driving part. I would say in this type of scenario, checking the driving when just 2 minutes left, alarm is rang, you have to address it immediately because driving is one of the important and sensitive issue in this case. And you just does time already finished, okay? And driving is very important. Now, my concern is, and my part is, hidden part is why patient is a home decorator, how it is connected with the scenario. This is the important part. Actually, home decorator are those involved to renovate and decorate their home. They have to sometimes, climb up the ladder to make something beautiful in the home, in the inside of the home. What I'm trying to say, there is some height involvement is there, right? They sometimes take and the ladder and climb up the ladder. So height issue is always there. So you have to address it, okay? And due to your profession, I believe that you sometimes have to step up the ladder, and that might be dangerous for your case because the episode may come again at any time. Although we believe with the medications, it's really controllable, but we don't know when it will come and the spark will create the abnormal shakiness of the body. This is the one part, the first part, okay? Second, doctor, due to my profession, I have to carry the equipment, renovate or decorate things from one place to another. So I have to drive the van or truck, okay? In total driving, you take that, that's very fine. But I would say take it a little bit earlier, okay? And that's why and you have to change the driving part and you have to address the driving part and you have to say, yes, you should not drive because you are putting yourself in a risky position and even an accident might happen. So, and we don't, we are connecting to the DVLA, a driving license authority. They will guide you when you can resume your driving. But for the time being, we believe you should not drive at all. Okay, so that's why the home decorator things is important here. Another part, and there are some equipment in terms of the home decorator professions. Okay, there are sharp machinery, running, drilling machines is there. So in the advice and safety netting part, you have to address it. Okay, I believe, or probably you have to handle a different sharp and moving object. Okay, and it is better to avoid or adjust your profession. Probably you can be in a monitoring side. Other staff will do that. You just give the direction. That would be fine. But actively handling the electrical or moving object or machinery can put you into risky position. Even it may, cause serious damage. Okay, that's why the home decorator. Another part, sometimes they may, I mean, uh, deal with the stuff. Some are hitting object, sharp machinery. Everything is just coming under the term of home decorator. So that's what the importance of the home decorator is. Address it. What actually you do? What's your jobs? What are the things you actually handle with? Okay, and based on it, that you have to answer this part very, very completely. Otherwise, if you look at the mark sheet actually indicate that if you fail to, although it's the mark sheet of the LCC part, but communication is very important. Almost same. So it involve the patients and use the jargon and management part. Okay, impact. If you can see, this is the impact, how it is impacting. And I always say impact always happen at three levels. Sometimes in the personal level, professional level, and sometimes on hobby. In this case, it is very important and mandatory to ask about their hobby. Okay, do you have any particular hobby like swimming, surfing, okay, dancing, climbing, uh, okay, scuba diving, anything. Okay, these are the things, activity should be prohibited or should be minimized or should be under someone's supervisions. Okay, so these are the things is very important. So the whole purpose of the scenario, not just explaining the epilepsy, at the same time, you're addressing the hidden part, what patient is not completely aware. As a doctor, we have to make them alert about few particular things on area of the life. There's an entire part. And concern. Throughout the conversations, you, Dr. Handy, did check, are you following me and getting me? That's fine. But you did not create a space. Do I have any concern at all? Okay. Always actively seek the concern. Are you following me? Do you have any concern at this stage of the conversation? I know it's really, really easy to forget. So this is how you can make it easy from the very beginning. How? When you are introducing yourself and taking the consent and checking the agenda, you can just make one sentence. Okay, I'm going to explain everything what happened, but don't feel hesitant if you have any questions, any concern at any point of our conversation. It means you're giving the complete autonomy to the patient that if any point they don't understand you or your sentence or any point, they will feel free. Even if you forget to ask or seek the concern, but examiner will notice that you give the complete autonomy to the patient. And if patient asks, that's fine. If they don't, you already did your job. Okay. So Dr. Indy, I say be a little bit explanatory in terms of explaining the epilepsy, what actually epilepsy mean, why it is different from the normal brain signal or electrical activity, and address the home decorator part and impact their profession in very detailed form. Okay, and safety net was completely missing. I have to ask what are the advice from your side. In that case, you have to make it spontaneously without raising any questions from the patient side. Dr. Henry, do you have any questions?
It was a good one. Just that I believe that the time was too short.
Sorry, I'm not getting you. Oh, please, can you just make it a little bit clear?
Yeah, I said that the time was too short. 7 minutes. I can't take all those issues within 7 minutes. It was just too short for me to.
Why
take all
this?
those.
Why this happened? Do you know? I mean, when you will explain, in a very plain way, it will not take time. Okay, and
Because
you,
this was my case in the exam, and I did very well. I just felt like the time was too short. This was my case, and I think I got I think I got 15. I just felt that the time you gave me was just too short, so I couldn't really explain. This was
so
my
far
case in the exam.
so far I gave you 10 minutes,
No,
probably
it was 7 minutes.
5
It was
seconds.
7.
Okay, yeah,
Yeah,
it was 7.
it's okay. It was good.
No, Dr. Hendy, I'm very honest from my side. I gave you complete 10 minutes. I don't know.
All right. Okay. It's all right.
Yeah. So, 10 minutes was given from my side. I don't know if I wrong. Okay. So 10 minutes was given. And now I would like to go to that part. Okay. What are the things probably the concern might be raised from the patient side? So these are the common dialogue. Okay. Patient probably say, doctor, I'm physically now fine. I'm very worried about the test results. You've already explained that. Yeah. And I just go to the concern meeting part. Okay. All the concern in one. Yeah. So these are the possible concern. Okay. These are the yeah, these are the corner. Is it brain tumor? Although I did not ask, so you have to make it very clearly. No, we are not thinking brain tumor, which is already evident by the absence of any growth in the brain. MRI showing completely fine. Okay, can I still drive to what? So to answer this type of questions, okay, when we are not completely out about the DVL guidelines or probably don't know the typical time frame, just connect them with the DVL authority. They will decide because it varies and depends upon the treatment response, type of vehicles they are driving. Still lots of point and factor you have to remember. Don't overburden yourself. Just involve the DVLA authority. Will I able to have a baby? Yes. And many patients are having baby, but your pregnancy period should be more monitored, and it should be ideal. And there's some drug adjustment is required. And one thing I forgot to mention, yes, during pregnancy, we actually suggest to involve the woman doctor. They probably add some medication like folic acid or other medication that will minimize the side effect on your baby. That's are the things you can say to the patients. Yeah. So any questions from anyone regarding this scenario? If there is no questions, we'd like to move to the LCC part. There is no questions, right? So Dr. Sadia, are you there?
Thank you, Dr. Mahmoud.
Yeah, thank you.
Yes, I'm here.
Yeah, okay, fine, Dr. Sadia. We're moving to the LCC part. So this is your LCC. Your preparation time start now. Let me know when you are ready. Okay.
Assalamu alaikum, doctor.
Yes, please.
Yes, I have one, please, if you don't mind.
No, yeah, carry on.
Yes. Regarding to the previous scenario, is it okay if she asking me regarding planning of pregnancy, I have to tell her that is we will start you with medication. It could be little safe during pregnancy, like lamotrigine, or not allowed to tell like.
It is better to inform the nerve doctor. You just say there are very good and series of medication. Yes, some medication is completely almost risk-free during pregnancy. Yes, there are some minor and very rare side effect, but throughout the pregnancy, definitely will keep you under monitor. Okay, there are also another medication the woman doctor will prescribe, we call folic acid, that will also minimize the side effect it may poses to your future baby. So this is how you can address that concern, but not completely in a very specific way, lamotrigine or something like that. It's not our task. It's the task of the neurologist or probably in the higher position consultant or woman doctor. You just can say, yes, there are some safe option is there. just we have to address and switch to the safe option during pregnancy.
Okay, thank you very much.
Yeah.
Okay, thank you.
Okay, we can start.
Yes, doctor. Yeah, your time start now.
Okay. Hello, I'm Dr. Rahman, one of the doctor in this general medical clinic today. Are you Mr. Alan Watson, 43 years old?
Yes, doctor. Mr. Alan Watson. I am 43 years.
So how may I address you?
Mrs. Allen is fine.
Okay, so Mr. Allen, today we'll talk with you about your health condition and I'll also examine you. Is that all right?
Yeah, yes, doctor. Thank you for coming.
Okay, so Mr. Allen, what brings you here today?
Well, doctor, I mean, today I was just walking and I was returning from a restaurant and just after doing the shopping, okay, I just suddenly fall on the street and I was
Okay.
unable to walk, okay, and immediately some bystander helped me to brought me to the hospital, and that's why I'm here, doctor.
Okay, so sorry to hear that. So
Mm-hmm.
did you lose your consciousness?
No, I mean, I was completely alert, well oriented.
Okay, so you were walking at the time.
Yeah.
Okay.
And by the way, I mean, I did not say, I mean, during walking, I was facing some problem and some pain was there, but all of a sudden, just completely fall on the ground.
Okay, so where the pain?
It's on my, I mean, back part of my thigh, as well as on my legs, doctor. Yeah.
Back, eye, and leg.
No, back part of my thigh.
Okay, okay, okay.
Yeah.
Back part of your thigh. Okay, okay,
Yes.
okay. Sorry to hear that. Okay, so did you feel any light headedness or anything before falling?
Yes,
Apart
doctor.
from the pain?
Yes. During that time, I was just feeling the whole wall is just spinning and just a garden is falling down. Just fall on the
Okay,
ground and then just immediately back to
okay,
normal.
understood. So did you have any abnormal shakiness in any parts of your body?
No.
Nothing like that. Okay. After that fall, did you feel any headache?
No, there is no headache, doctor.
Okay. Any confused?
No, there's no confusion. I was fine.
Okay. So, did you feel any weakness in any parts of your body?
Yeah, I mean, since then, to be honest, I was feeling completely weaker after come to the hospital, feeling a little bit better, but still I'm very, I mean, concerned about why this happened. Yeah, so following the episode, yes, I was weak, completely weak. Even
Is it
standing was really tough for me.
okay? So only standing and in no specific part, like
No,
any
no, no.
limbs.
Even standing was really tough for me.
So it's overall weakness in the whole body. You feel
Yeah,
like that.
yeah.
Okay. Okay. Sorry to hear that. Uh, any abnormal sensation in any parts of your body? Did you feel?
I would say the sensation is fine, but there's something I'm just feeling cramping type of pain in my hands muscle as well as also my calf and thigh muscle, doctor.
Okay. Sorry to hear that. So the cramping pain is for how long you are having this?
It's just during the episode, okay, and it also lasts for 30 or 40 minutes following the episode.
Okay. 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 So do you have any vision problem or any problem in seeing?
No, my vision is fine.
Okay. Any problem in your hearing?
I can hear properly, doctor.
Okay. Any balance problem you ever felt?
I mean, to be honest, it's the very first episode. Prior to that, I was completely fine. So, yeah, since the episode, I was brought to the hospital. So I don't know actually any balance problem will happen or not. But
Okay,
yes, during
understand.
that time, I just completely lost my balance and fall on the ground.
Okay, okay. Sorry to hear that. So, do you have any raised body temperature?
No, I think it's normal.
Any weight change?
Weight change, no.
Okay. Do you feel dizzy from standing, from sitting position?
Mm, I don't, I did not notice, doctor. Now I'm feeling fine.
Okay. Any difficulty in walking up in the stairs or any combing your hair?
And doctor, actually, I said it's very first time. And,
Okay.
and since then, I'm in the hospital. I did not know anything will happen after back to the in home. I have to check is there any climbing
Oh,
problem or not. Yeah,
okay, understand. So how is your water work?
sorry.
Water work?
Water works is fine.
Any increased frequency or any like,
No,
for
no, nothing changed
okay.
much.
How is your bowel work?
Bowel is fine, doctor.
Any loose motion or tight motion?
No,
Okay. So okay, understand. So do you have any non-medical condition that I should know?
mm,
Any high blood
so
pressure
far,
or any
no.
hyper high sugar,
Sorry, hyper?
high blood pressure or any high
No,
sugar?
no,
Nothing.
no.
Okay. So any medical condition? Do you take any drugs? Any? Can you show me your drug list? Do
No,
you ever
I'm just
take?
taking intermittently vitamin D and calcium. That's it.
Okay, vitamin D and calcium. Okay, understand. So no recent stoppage or adding any medication.
No, there is no any recent addition of the medication.
Okay, so do you have any same thing that runs in your family, like this cramping pain or anything?
Yeah, I mean, interestingly, my GP asked me the same question, but I think no, every family member is leading normal life. It never happened kind of episode. Okay, yeah, my father had a stroke, but definitely stroke had different presentation, not like this. Yeah, but
Okay,
other than everyone is leading normal life.
okay, okay. So okay, okay. Can I examine you?
Yes, doctor, you can.
So at first, I'd like to start with the lower limb, as the patient is having problem in
Fine. You want to check the lower limb, right? Okay,
Yes.
so what you want to check? Give me the complete instruction.
I'd like to check the power in both legs.
Okay, fine. You are checking the power.
Yes. Right on and the left is okay.
By
So
the way,
both
this is
both
proximal and distal in both area. The muscle power is
okay. So both leg power is 1/5. Okay. So after that, I check the reflex.
you want to check the reflex. Please give me the instruction. In neurology, instruction is
Okay.
important.
Sorry, I'm going to tap. This is the rubber object. I'm going to tap over your muscle here. So at the knee, what I will say, the in the
It
knee,
would not hurt you. It would not hurt you. Okay,
it
fine.
will not hurt you. So I'm going to tap here. So knee and ankle both is diminished. Okay. After that, I'm going to I'm going to scratching with this sharp object in your sole of the foot. Please bear little with me. So I'm going to check the reflex.
Seems to
Sorry,
reflex.
plantar reflex. Plantar. So both are flexor. Okay. So after that, I'd like to check the coordination. As the power is diminished, I think it could not be possible. So after that, I'd like to check the tone of this overall during my movement. I'd like to know about the tone.
Tone is reduced in
Tone is
both legs.
reduced. Okay. Okay, so understand. So after that, I'd like to check the upper limb. I'd like to check, ask her to pull my hand, to take my hand and pull towards you.
Upper limb also weaker, but muscle power is 3/5, not as much as like the lower limb.
Okay. So it is like 3/5. Okay. So the after that, I'd like to check the sensation in the lower limb. I'd
Sensation
like
is
to at first I'd ask her to if she can feel the sharpness in his chest. Then I'd like to place in the great toe region.
patient can feel it, doctor. Sensor is fine.
Is it the same?
It's same.
Okay. So after that, I'd like to check in the upper limb. I'd like to check the Hoffman sign.
Hoffman is absent.
Okay. So then I'd like to check the pulse in both upper limb.
Pulse.
Yes.
Okay, pulse is 110 in both.
Okay.
Radial pulse, there is no radial delay.
Okay. So after that, it is regular. Pulse.
It's regular.
Okay. So after that, I'd like to listen the precordium heart sound.
You want to check the precordium. Let me know which area you want to check.
I'd like to check the all 4 areas to learn the heart
Fine.
sound.
Listen, let me know when you want to switch the area.
Okay. 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 After the tricuspid area. Okay. Then pulmonary area.
Okay. The whole area, the same sound. If I just put it here, the same sound.
But in pulmonary area, is the sound same?
Yes. All the heart sound is normal, I'm saying.
Okay. So after that, I'd like to. Do you have any infection and sorry, do you have any known thing happened within this period? Any? Do you ever feel sick or do you have any hospitalization in this period?
No, I mean, last time, I mean, it was 5 years ago. I just once hospitalized. Okay, it was long before, and since then I'm pretty fine.
Okay. So, do you know why you have to admit that time?
No, I mean, the doctor said, I mean, I mean, I developed terrible diarrhea and loose motion, and that's time, yeah, I
Okay.
just was admitted, and doctor gave me some, I mean, fluid, and also I have to stay in the hospital for 2 days, and then I was discharged. That's it.
Okay. So I'm asking some personal question. Do you smoke?
No,
Do you take alcohol?
occasionally, yes, doctor.
Okay. So how is your diet? Do you recently take any heavy meal?
Mm, um, yeah, I was just returning from a birthday party. Yes, um,
So when it was?
it was the same day, doctor. Today I was just returning from the.
Okay, understand. So what do you do for living?
I'm a school teacher.
Okay. So
2 minutes left.
okay. So does it affect your job now?
Definitely, I'm thinking. As it happened today, so I'm very concerned. I mean, the
Okay.
witness may appear again or not, or will it
Oh,
reside? Yeah.
okay. So we'll involve the occupational health worker, and they will help you regarding this. Okay. So after that, okay. Um, okay. So do you drive?
Yes, doctor. At the weekend, I have to drive every single weekend.
Okay, so as you are having some sorts of weakness, so I will advise you to stop driving and inform the DVLA, and they will assist and they will help you regarding this. So, what is your concern, Mr. Otson?
So, doctor, what's wrong with me? I mean, is it
Oh,
something in my nerve cable of my back that causing the problem? Because my father had a stroke. Now I'm thinking, is something wrong in my brain or nerve cable, doctor, that causing the problem?
okay, Mr. Allen. Actually, after talking with you and examining you, I have a possibility that the condition you are having right now it is due to on kind of salt deficiency in your body, and that's why you are having these sorts of problem. But we can have to do some more scan, and then we can confirm you actually what is the problem is for your symptoms. Do you have any
So,
more concern?
yeah, I mean, what type of solve problem you are meaning that I'm not getting properly, doctor? Is it happen to every patient or is completely unique in my case?
Actually, Mr. Watson, yeah, sometimes it's happen in anybody's anybody's body response differently. So it can happen to anybody. We cannot predict that, and
Time up.
sometimes it happens in family. Okay,
Fine. We're starting crossing. Can you present
okay.
your positive findings?
So my Mr. Allen presented with collapse for on days back, which is sudden in onset, and he on his thought on his what to say, on his thought it is like when he was walking he feels sudden weakness in his both leg, and then he falls. Apart from that, he also complaining of some sorts of pain in cramping pain in his both thigh and leg muscle, and all this the complaint he is having. And on examination, I have found that the power is in the lower limb is diminished, and also the reflex is diminished. Plantar is flexor, tone is also diminished, which gives like a lower motor type of neuron lesion present. And upper limb, the power is also diminished, and it was 3/5. And that's all the positive findings I have found.
Okay, fine. So putting all together, what's your impression?
So I'd like to put a possibility that it could be due to hypokalemic periodic paralysis, or
Mhm.
other possibilities I'd like to put to no risk factor, but to GBS I'd like to put
Sorry, what is the second differential?
GBS Guillain-Barré syndrome.
Okay, GBS. Fine. I want to investigate your, I mean, what would be your investigation, madam?
Okay, I'd like to do some general investigation that would be include CBC, serum creatinine, and I'd like to do serum electrolyte to know about the potassium level, and also renal function test. And I would also like to do some investigation to rule out other condition that would include nerve conduction studies, and that's all.
That's all okay. Fine. And what would be your treatment plan?
So after confirming my diagnosis, I'd like to form a group of specialized doctors that would be consisting of a neurologist and also that will include neurologist, and then you'd like to run the investigation, and after confirmation of the diagnosis, if it is hypokalemic periodic paralysis, then correction of the potassium should be the goal, and if it is other cause like if it is TBS, then we will have to go for the IV IT treatment or the plasma exchange, whatever could be suitable.
Fine. Okay, so still you have time if you want to add any important treatment if you think. Fine. Okay, we are just concluding. How does it go, Dr. Sadia?
It was good. I don't know actually.
Fine. I would like to connect with the other candidate. Okay, what you were thinking as a differential in this case. Mention in the comment section, or you can also unmute yourself. What are the potential differential in this case you were thinking?
Recording in progress.
Any important comment from your side, or anyone has an important? What are the differential diagnoses in this case? There's no comment. Okay, fine. Well done, Dr. Sadia. You got the diagnosis, but there are lots of things I think in the missing side. Okay. And you just examine the lower limbs, and after examination, you got the lower motor type of neuron lesion. Then you took, again, just focused one history, try to connect, okay, did you recently took heavy meal or probably exercise by profession? You are trying to find out that. That's really good that you really and quickly can connect the things. That's fine. But there are lots of things missing in the history and also examination part that we like to discuss. Okay. In this case, when any patient presented with collapse, and the first question should be what they mean by that. Okay, did you lose your consciousness or just you fall on the ground? And collapse might happen due to many causes. It can happen due to problem of the brain. It can happen due to problem in the muscle. It can happen due to problem in the nerve cables. Okay, even mechanical collapse can happen. Okay, what are the mechanical collapse? Osteoarthritis. Okay, or just patient is very supported on some walking stick. Probably they just lost their stick, or probably there's no support system. They just fall. There are lots of things of collapse. That's why the first question should be very clear. What you mean by collapse? Okay, did you completely black out or completely out of the park or world, or just have consciousness but you just fall on the ground? Yes, doctor. Okay, is there any weakness associated? Okay, what do you mean by collapse? Is there any weakness of the legs or hands or whole body? Then they will say, doctor, I'm feeling weak, as if I'm not getting enough energy to stand up or walking. Okay, so that's the first question should be. Then you have to be more specific. Okay, is it, okay, what do you mean by that? I mean, is it one legs or bilateral? I mean, both legs. Okay, is it something like you're not getting the sensation or not feeling the touch or something like that, any tingling or numbness? Because you have to differentiate it from the neurological, from the muscular, from each other. Okay, then come to a conclusion what's actually causing the problem. And the next question should be, is it for the very first time or is it happened before? You asked me, Dr. Sadia, later part, but the question should be very earlier. Is it for the very first time or is it it happened in past? And if so, when it was the last time? Did you admit in the hospital? Did doctors say any particular diagnosis and how you recovered? Okay. So these are the key questions you have to ask. Otherwise, periodic hypokalemic paralysis would be tough. Okay. The one patient will say there is a muscle cramp. It's a very big clue. Okay. And this single symptoms, patient statement can help you get to the diagnosis. Now, there are a few questions. Why this happened? The periodic paralysis mean it happened periodically. What is the provocating factor? In that case, there are lots of provocating factor can be. stress, dehydration, loss of, salt. It can be due to gastrointestinal loss, urinary loss can happen, loss of salt, excessive alcohol, even hot, humid environment, sweating a lot, and most importantly in this case, heavy meal. Heavy meal or strenuous exercise. These are the precipitating factor, and you have to ask every questions isolatedly, okay, to find out the underlying cause. What did they do? What actually they do? What actually they're doing during that time? Is it in a sunny day they're gardening or playing football or doing excessive exercise? These are the key question. And if you find any stressor, you have to address it, which was missing. You found the stressor that patient had a very heavy meal, but you did not say this happened due to heavy meal. There is some imbalance of the salt within the body, and that causing the problem. You got the underlying cause, but you did not address me. And if you don't address the factor, they will be unaware about the factor, and this type of episode will recur again. So this is the area examiner is looking for. Are you addressing or not just keeping it untouched? So these are the key questions. Then you have to also exclude some neurological cause. What are the neurological cause? Although you got the clue, still you have to show the examiner that you are completely aware about the brain things, okay? What are the brain things? Brain things means, okay, do you have any vision problem, any headache, any weakness, any particular side of the body? Okay, what about your water works? What about your bowel works? These are the most common question you can ask. Then lower limb weakness, it can happen due to any injury or back or spinal cord problem. Do you have any recent injury, any problem in the back, any injury or in the back? These are the questions you can ask. Then there are some mechanical issues like any muscle weakness, okay, any muscle weakness, any knee joint pain. If the patient is ill, in that case, we have to ask any knee joint osteoarthritis that can be a cause of mechanical collapse, okay. As this case is collapse, so there are few other metabolic cause as like this case will come into the equation, okay. So there are lots of cause that can collapse. Do you have any past medical history? If there is any diabetes, in that case, hypoglycemia can be a cause of collapse. Even hyperglycemic, non-ketogenic coma, not coma, diabetic ketoacidosis may presented with, collapse-like features. Not commonly. Just stick to the diabetes, okay, diabetes. Diabetes, autonomic neuropathy can cause postural dizziness, and that may present with that collapse. Metabolic cause, electrolytes problem, right? Even hyponatremia may present with collapse. And in this case, hypokalemia actually the underlying cause. Why this happen? Up taking heavy meal, usually heavy meal, insulin secretes a lot. The insulin spike also happen, and insulin actually causes the potassium and send the potassium into the cell. And during that moment, potassium become lesser in the circulation, and that may patient may present it with this type of features due to some imbalance in the sodium potassium ATP pump. Okay, so this is another cause. Another cause could be, another metabolic cause could be thyroid problem. In fact, in this case, I was expecting that you will at least, look for the patients. You did not offer me. That's why I did not show. Okay, patients have some goiter. And when patient has goiter, you have to examine all the, thyroid part. You have to palpate, auscultate, you have to do some eye sign, okay, lid retraction. You have to check the A sign, okay, to see any cranial nerve is there, okay. And checking the hands. You did not check this part, although you, completed the history. Initially, there were actually, adequate time, but you did not. Even you did not offer me. I would like to have a general look to the patient. Patient has actually thyrotoxic eye, okay? Lid retraction is there. And this is anxious look, is hysteria look. Okay, patient has not diffuse goiter, but yes, there are some multinodular goiter indicating thyrotoxic features. So taking the hands tremor, asking about the weather preference, loose motion, about their mood is very important. In this case, was completely missing. Yes, sometimes in some calibration examiner, patient may say, yes, doctor, I have past history of thyroid problem or gland problem, but the case would not be always the same. They will try to keep it hidden, but they will give you probably this is the very first time patient presented with these features. In that case, you have to find out the underlying cause and precipitating factor. I was happy that you tried to exclude the cardiac cause by examining the cardiac part. Yeah, that's fine. That's fine. But metabolic cause was missing. Even there are few other things that where patient may present it with collapse. Okay. Even another rare feature, patient may present it with collapse, acute intermittent porphyria. And during that time, patient almost presented with flaccid type of paralysis, maybe with the Guillain-Barré syndrome-like features, right? And this is also metabolic. And during that time, a very funny Coca-Cola color urine is noticeable, right? Yeah. So when this type of things is happening, one question should ask, and you indeed ask, is there any confusions? Okay. Are you well oriented with the situation? Actually, when there is some involvement of the sodium, patient usually presented with confusion-like features. And in fact, that's why in acute intermittent porphyria, patient has CR-like features and patient presented with confusion. But in periodic hypokalemic paralysis, patient usually is well-oriented with the situation or surroundings. Yeah. So checking the face is very important. As you are thinking, Dr. Sadia, about the Guillain-Barré syndrome, as a part of your examination, at least you have to examine the face. Okay, have to examine the face and offer the bedside few other things like forced vital capacity. Do you have any shortness of the breath is there? But as you're thinking Guillain-Barré syndrome, checking the eyes is very important because one of the trait of the Guillain-Barré syndrome is Miller-Fisher variant, right? Where patient might have some ophthalmoplegia, right? Even in the face, if you look, patient might have bilateral facial weakness. So these are the lots of signs you can get in this type of scenario. And that's why it's very important to have a good looks from top to bottom. Yeah. So yes, you did everything in the neurological part and also cardiological part. And in terms of the concern, I was not completely happy. The concern was partially met. Why the concern was partially met? And you spent a lot of time in the examination part. The concern was almost overlooked. Just you touch at 45 seconds, when 45 seconds is left. The concern should be like this, okay? And okay, we are thinking, I'm talking to you, and after examination, we are thinking a range of possibilities. One of the possibilities we are thinking on top, that after taking a heavy meal, there is some salt imbalance usually happen. And another possibility we are thinking you might have some gland problem that's secreting excessive protein, has some correlation with the salt, and that causing the weakness. And suddenly you are falling on the ground and having this weakness. We have to admit you, do some blood test, and also examination of the do some blood test and check of the salt. And we also like to give you some salt containing solution that may recover your symptoms. Okay. In the meantime, once all the test results will come, we will form a team of doctor, including gland doctor. Okay, gland doctor and other specialists to give you the proper care. And in your case, as we have found that there is a stressor is a heavy meal, we usually suggest don't take heavy carbohydrate containing meal. Okay, glucose containing meal that can precipitate this condition. Yes, then you can ask, is there any other concern? Patient might have different type of concern. We don't know, but we should at least do the basic. Do I need admission? Do I need any important drugs? In this case, salt containing solution. Form a team of doctor, multidisciplinary team, do some investigation, especially salt level in the blood, and will give you treatment. Okay, in this case, treatment is salt containing solution. Okay, Hartmann solution, potassium containing solution. Yeah, so that part was missing. Examination, I already said that. In the jargon part, communication part, I did notice that you mentioned a jargon, not jargon typical. So you said drug. Actually, drug sometimes is a not appropriate medication. I mean, are you taking any medication? Drugs sometimes mean mean by illicit type of medications, right? So use the drug, use the medication, use the medication. Yeah, what are the things I did notice in the investigation part? Yes, in the investigation part, sorry, before investigation, in the differential part. In the differential part, I was very happy that you hit the top two calamity paralysis. You said periodic paralysis, that's fine. Okay, periodic paralysis. And second one is GPS. The GPS is another box. Have diarrhea or any other features, even addition can be the equation. And sometimes addition presented in the same kind of collapse like episode. There are lots of room for putting some differential, okay? Differential in this case. Then in the investigation panel, you just mentioned the salt level, but in this case, without doing thyroid level, T3, T4, thyroid autoimmune test, antibody level, even sometimes, muscle enzyme like creatine kinase is very important. Renal test is important because you have to check the renal. Why renal test? Renal function test is very important because in type 1 tubular acidosis, hypokalemia may present, and in that case, patient might have this kind of features. Okay, so taking renal test is also important. Renal function test is important. Apart from the renal test, you have to exclude the Guillain-Barré, right? So nerve conduction study, EMG, which was missing. And as you want to be in safe side, as a safe doctor, you want to exclude the cardiac part. So ECG should be in your list. Okay, so there are lots of investigation you missed. You just mentioned salt level and NCS, but yes, definitely you have to mention TSAs, EMG, and echocardiography. Yeah, and the treatment part, I think you address the treatment part at the same time, make the patient alert about the stressor. Stressor means provocating factor in this case. Don't do excessive exercise. Don't take heavy carbohydrate containing meal. Okay, if you sweat a lot, okay, always try to drink water or salt containing water is very important. Yeah, so these are the things is very important. Any question, Dr. Sadia, do you have from your side?
Okay, no, I understand. I actually totally forget about the thyroid part.
Yeah, you forgot at the thyroid part, you forgot about the proximal myopathy. Just assume in this case, patient recently been diagnosed with heart problem and patient is on Atova. In that case, this Atova medication can cause muscle cramp like facial collapse is uncommon, but there are lots of stimulation can be calibrated from the back end. And believe me, in the cases, most of the candidates detect the diagnosis. They don't, in very, very few cases, okay, out of 10, I would say 3 or 2 candidates miss the case completely, but 7 candidates detect the diagnosis. The problem is the marking. They lost mark from every scale, and ultimately that, bleed their, passing rate. That's the issue. So I would say, getting the diagnosis is comparatively easy, to be honest. 7 is rate is 7 out of 10 candidates. 7, even 8 candidates get the diagnosis, but not addressing the all the skill, not taking the adequate history, not excluding the risk differential. In this case, Guillain-Barré 1 and thyroid issues is important. And examination. In this case, if you just look at the thyroid part, there are lots of things you can do by simply observation, right? So as you missed completely, you did not offer me, I did not explain. So there are lots of thyroid part is there. Yes, I'm completely agree. You did the neurological part very good. You also check the cardiology part, but I would say one part is missing. Carotid. If carotid checking is very important, right? The carotid is very important. Auscultation. Respiratory is not important in this case. I just put it here as a part of CBS. If you think in that case, just offering the forced vital capacity or beside just blow test, these are the things. But the case should be the different in this case. Just keep in mind case wise. So what are the differences? There are lots of differences you can think. Actually, I put the Gulenberg in the first position. I did not calibrate and I did not just put in the second. Actually, your diagnosis is right. This is familiar, not familiar actually. Thyrotoxic, hypokalemic periodic paralysis. I did not actually announce it. I just put in the random. I forgot to announce it. Okay. Then second is actually Guillain-Barré syndrome. What I'm trying to say, there are lots of room for thinking different cause in this type of periodic paralysis. Okay, it can be gastrointestinal loss, it can be renal loss, even isolated thyrotoxic myopathy can cause this type of sudden collapse. When you don't have any justification point, even only thyrotoxicosis can justify your answer, right? Even polymyositis, dermatomyositis may present with sudden collapse-like features. And by the way, collapse actually patient word, right? You have to make it clear what actually they mean by collapse. In the investigation part, yes, there are lots of room for mentioning different investigation. You just mentioned a few. I would say mention creatine kinase, which is important. Don't forget thyroid panel. Just time is just running out. Just single word thyroid panel. I would like to do thyroid panel. An examiner will understand. Yes, you wanted to enter thyroid panel. That's fine. Yeah, checking the magnesium is important because serum potassium and magnesium is twin, right? Sometimes deficiency of magnesium can cause unresolved potassium deficiency. Always check it. Yeah. Any questions up to this point?
Doctor?
Yes, please, Dr. Hassan.
Doctor, in a case of hypokalemic periodic paralysis, we are suspected to be a recurrent or could be the first time at this age?
It can be first time in my case, and in this case particularly, I keep it first time. I tried to give a little bit flavor in one episode 3 years ago. I was hospitalized, they give me some saline, and I recover.
Okay.
But the good news is, yes, it can be the first episode. If you look at this part, then definitely things will pop up in your mind, right? Patient has thyrotoxicosis, how I connect. Always try to connect. Is it something that can give the same type of features of paralysis? Now, I'm just trying to think, connect and bring some new idea that things can, in medicine, this is interesting, okay, things can happen in many cases, especially presented with collapse. Now, confusion. Definitely, the collapse is not due to potassium. It's due to sodium, right? Or it's due to calcium. Or due to magnesium, phosphate. Many things can happen. But when patient has collapse and patient has hypertension, patient is young female particularly, okay, young female, and has interesting urine color, so you should think about EIP. And it may present it with collapse. In between the attack, patient is completely fine, as like periodic paralysis. So it's one kind of paralysis, right? Or, acute intermittent porphyria. Patient presented with collapse, confusions, right? Intermittent confusions. It can be calcium deficiency and patient has familial history, okay? Or patient has, I'm giving it another clue, short fourth metacarpal metatarsal joint. In that case, it's pseudo hypoparathyroidism or McConnell-Bright syndrome, right? Patient has collapse. Now confusion. You can think about some neurological case, but there are a few examinations that can help you to narrow it down. If there is any, for example, any visual hallucination or upgas problem, you can think about Lewy body, progressive supranuclear palsy. Okay, if there's any unilateral weakness, you can think about some cortical relations. Cortical relation means It can be trauma, TB, tumor, stroke. Okay, there are lots of room for. If only lower limb, you can think about some, spinal cord problem or peripheral neuropathy problem. Okay, so examination of all the system is very important. Not in detailed way. Even in the neurology, if you just check few things, okay, can you raise your leg for me? Checking the power. Okay, power is 1/5. Just with the permission, scratch the sole, check the plantar, and get the reflex. You can narrow down your difference. Yeah. Okay. And the advantage and the good part of the LCC is that you don't have to maintain chronological order of examination. You can just do one thing. If you think it's necessary for me, I would like to do plantar. If you think I would like to check only mitral and carotid area, that's completely fine. And that's why focused examination idea came. Okay, you don't have to be very systematic like the clinical station. So that's why there is a huge time. 4 minutes. Within 4 minutes, you can check a lot of stuff. Okay, in the LCC. Okay, don't be stigmatized like I have to do everything. Starting with the hands. No, it's not necessarily. Even you can start it with the lower limb like Dr. Sadia did. That's completely fine. But what actually works, actually examiner always expect that the patient, the candidate, doctor will be systematic, practical, well practiced, well organized. This is the expectation. But in this type of scenario where the case is a little bit different, a little bit randomness is accepted, as long as you are covering the major part, checking the thyroid, checking the heart, and checking the lower limb. So, Dr. Sadia, thank you for taking the case. And yeah, well done. I would say, detecting the diagnosis is very key in this case, but I would say there are some missing points, work on that. Always meet the concern in a very very detailed way. Detailed way means at least check these 5 things. Admit, okay? Admit means always ask, do I need admission or not? Do I need to start any medication? Forming multidisciplinary team, any important investigation, any important management, treatment. Yeah.
Okay, thank you.
You're most welcome. So, any questions from anyone? And by the way, these are the very recent case coming in UK, Jeddah different center. Okay, just be open now. Basis format is changing in regard of they are just putting any case in the LCC, even exacerbation of the COPD, interstitial lung disease, bronchitis, the short case are coming and setting as a long case. So be open, okay, in your approach. Hopefully, you can crack it. Yeah. So thank you for joining and thank you for participating. So we'll see you soon on the next session. Till then, goodbye. And those already got the seat, I would say practice daily. Practice daily in terms of the clinical station. Examination step carry 24 months, right? You can do on your children, on your partner, okay, but do it. Even you can do it on bolster, but you have to do it, okay, to be very spontaneous. Otherwise, things would not come naturally. The high pressure BASIS exam. BASIS is not a tough exam. It's tough because of its environment, because of its intensity. High stake, high price, high prestigious exam. That's it. Thank you. Wishing you all the best for all exam candidates. See you soon on the next day.